Thank you very much, Mark, and good morning, everyone. And thank you, Mark and Melanie, for giving me the opportunity to be here with you today. I was asked to take a few minutes at the beginning here to talk about an ecological model of health, which hopefully will serve to provide some context for the more detailed discussions that are going to be coming in the presentations to follow. So, by an ecological model of health, we might begin by recognizing that the individual person is progressively nested within a family, a community, ecosystem, and society. This nested set of relationships is characterized by a rich set of dynamic interactions that can change over time, over a lifetime, and so forth. And you actually can see reflections of these various levels at even smaller levels, for example, the organ level, the tissue level, and the cellular and subcellular level, and I think we'll be hearing more about that today. If we look at the set of variables that can influence the behavior of this complex nested system, they are numerous, obviously, but they do fall into some categories. There's clearly genetic variables. Then there are toxic chemicals, and we'll be hearing about some of them today. There's diet and nutrition, and at the community level, we can think about food access and availability. Socioeconomic status, both at the individual level, but also at the family and at the community and neighborhood level. There's stress, which can be adaptive, but at some point it becomes toxic, and we'll talk a little bit about that. Racism as a community or a societal level variable, and then there's the built environment, housing, transportation, and various community assets, including community safety, green space, and so on. And then there are others like radiation, noise, heat, and biologic agents, and so on. So that's another sort of dimension of this ecological framework, this wide variety of variables. And then we can put in another dimension, which is time, which is also very important. Time, we'll be hearing today, for example, about the importance of timing of exposures during the lifespan, when an exposure during a particular time of vulnerability can have long-term downstream effects. There's also the whole issue of personal time and aging, where our relationship in this dynamic set of relationships during our lifetime often changes. There's intergenerational time, where we're learning more and more about how certain features that are the result of environmental exposures in one generation can be passed on to subsequent generations. And then there's historic time. By that I mean that if you think now about what this set of relationships looks like today, it's really quite dramatically different from what was 2, 3, 4, 5 decades ago. There have been major changes in this complex set of relationships for lots of reasons, which I think we can all understand. We might also add, I should say, an aesthetic dimension to this model. I won't go into that, but I think it's an important thing to consider, and I think maybe the effect of green space, as an example, could have an aesthetic component that influences health. And for some people and for some communities, there's a spiritual dimension as well, and by that, I mean not only religious, but also secular. That's very important to some people and to some families and some communities. Lauren briefly showed this slide. It comes from a paper by McHale et al., and I should say that Lauren was a co-author, and so is Gina Solomon, who is formerly with Cal EPA. This is another graphic representation of some of the same ideas, where at the top here you see a lot of extrinsic factors. What they're trying to get us to think about, rather than gene and environment interactions, or not rather than, but in addition to gene environment, think about intrinsic and extrinsic interactions. So we have a number of things in the extrinsic field at the top that interact with intrinsic factors, things like genetic background, nutritional status, mental health, metabolic capacity, hormone levels, and so forth. And notice that the arrows that go between those two layers are bidirectional. There's a lot of feedback going on there. But collectively, this system then influences health, which you see in the bottom panel. And as Lauren mentioned, you can begin early to set a trajectory for resilience or for vulnerability that can influence life across the lifespan. So we've now take that sort of theoretical framework and begin to apply it to neurodevelopment. I've listed here a few of the variables that have an influence on children's neurological development. You can see them beginning with maternal health, even before pregnancy, and then, of course, prenatal events, preterm birth, and then exposure to toxicants, nutritional factors, socioeconomic circumstances, stress, and infectious agents, and so on. So let's just look at a few of those. First of all, important to remember that brain development depends on a carefully orchestrated sequence of events that begins early in embryonic life, continues throughout fetal development, and through infancy and childhood, and in fact, well through the teenage years, and so on. Cell division, cell proliferation, cell migration, synapse formation, the pruning of synapses, myelination, and so on, that must take place in a relatively orderly sequence and sequence of events in order for optimal brain development to occur. And disruption at any point along that line can have a cascade of downstream effects, which actually can be long-lasting. So that's the time dimension of the model. Now, if we get into the issue of neurodevelopmental toxicants, I'm not going to spend a lot of time on this, but I want to point out that we know a lot about a number of neurodevelopmental toxicants, and we're going to be focusing on air pollution today. But there are others, as you well know, and there's a project, for those of you who aren't familiar with it, I just want to bring it to your attention. It's called Project Tender. Tender stands for Targeting Environmental Neurodevelopmental Risks. There's a consensus statement that's been published in Environmental Health Perspectives. This is the result of a collaboration of scientists and clinicians and advocates who have come together to sort of synthesize the science and to advocate for policy reforms. And Irva Hertz-Peixoto, who is here today and will be speaking, is one of the co-leads of that effort. If we look at nutrition and brain development, as is typical in nutritional epidemiology, tend to divide this up into macro and micronutrients, but we can say with certainty that there are a number of these nutrients that are important for normal brain development. Things like adequate protein levels, long-chain fatty acids in particular among the healthy fats, iron, iodine, particularly because of its relationship to thyroid hormone levels, zinc, choline, and a number of vitamins. And deficiencies in one or more of these nutrients can impact some of those important events during brain development that I previously described: cell proliferation, synapse formation, and so on. And the greater the deficiency, the more likely there is to be really long-lasting impacts on brain development and function. This is not a problem that's confined only to the developing world, where there is really profound malnutrition among large members of the population, but in fact here in the United States, about 1 in 6 children in this country are food insecure. And if you look just at iron status, you find that about almost 20% of pregnant women in the United States have insufficient iron levels, and about 5% have frank iron deficiency anemia. Now, if we look at stress, both maternal stress, that is before or during pregnancy, and this is stress as defined by the things I've shown here: financial and legal problems, relationship problems, exposure to violence, home problems, discrimination, and so on, or infant and childhood stress, and in particular what is often called adverse child experiences, things like neglect and poverty and exposure to violence and child abuse and so on. So either maternal stress or infant and child stress can cause changes in brain structure and function that can be long-lasting and can be manifest through multiple mechanisms, some of which I think we'll be hearing about later today. This is just one slide from a study to point out what happens when you begin to combine these in an analysis. So on the x-axis here is third trimester blood lead levels in pregnant moms. This is a study of 540 women from Mexico City. It's a collaborative study of people from the School of Public Health in Mexico City and collaborators from Harvard and from Mount Sinai in New York. So they looked at, measured blood lead levels during pregnancy and then followed these kids' neurological development as they grew up. On the y-axis is cognitive scores at 24 months of age using the Bayley scale of infant development. And the lines represent progressive levels of negative life events in moms during pregnancy. So the very top line is 0 negative life events, as I described previously. The next line down is 2 negative life events during pregnancy. The next one is 4, and the next one is 6. And what you see is at low blood levels is a real stratification of the impact on cognitive function in the children. But as the blood lead levels in moms during pregnancy begin to go up, you begin to see an impact on every one of those levels of stress stratification, but you begin to see some interactions as well. The other thing that's notable is that moms with 6 or more negative life events during pregnancy, their kids start out, regardless of what the blood lead level is, at a fairly low level. And adding lead to that doesn't have much of an impact. So it raises for me some interesting questions about what we should think about in terms of public policy and where we should be intervening, and I'll come back to that in a moment. The two are, by the way, the left is the girls and the right is the boys. So we can say that a number of environmental stressors and then nutrition and major life events and trauma and abuse have a cascade of consequences through the community and the family and the individual, with impacts on cognitive and intellectual function as well as behavior and so on. But let me move now to neurodegeneration, looking a little bit farther ahead in the lifespan. I think we can summarize by saying that toxicants, nutrition, stress, beginning early in life can set into motion mechanisms that then have an impact on neurological function later in life. And there are a number of mechanisms that are involved, and I'm sure we'll be hearing more about those as well today. We're going to be hearing about air pollution, so I'm not going to talk more about that now. But I just want to point out for that neurotoxicant lead, about which we know so much in children and the impact on children's brain development and function. We now know that higher lifetime lead exposures, as measured by bone lead levels, is associated with lower cognitive test performance much later in life. And interestingly, in the same study that was then published somewhat later, it was also determined that neighborhood level stressors that lead people who live in those neighborhoods to be more vigilant, to feel a sense of threat, which is chronic and so on, that those stressors amplify this association between lifetime exposure to lead and subsequent cognitive decline. So if we think about cognitive decline and the most common kinds of dementia, I think we can say that prevention requires multidimensional efforts that involve diet, exercise, smoking cessation, healthcare, better education, and so on across the life course. I think that's pretty clear. But what's also interesting is that about 4 studies in Northern California, four studies in Northern Europe and 2 studies in North America are showing that the age-specific incidence of dementia has been falling in recent years. And the authors of these studies have largely attributed that to better education, less smoking, more exercise, better diets, and so on. And I don't think there's any doubt that those have contributed. But in the Framingham study, which is one of those published here in North America, they looked at what they know from 3 decades of data on the Framingham participants and found that those things I just mentioned do not fully explain the decline in age-specific incidence of dementia. And I wonder, and I think it's a supportable hypothesis, whether 40 years of improved public policy that have resulted in drastic declines in lead levels in an entire population and improved air quality in most areas of the country are not also contributing, and that we're seeing this as an unintended or an anticipated benefit of public policy that was begun more than 40 years ago. So among the observations, we can say that an accumulation of adversities beginning before conception and continuing throughout life can disrupt brain development and function. And I would note that many people who are working in the field of early child development rarely discuss neurodevelopmental toxicants. And I'll give you two examples. One is an ongoing study that's going on at the National Academy of Sciences, which is looking at neurobiological and behavioral sciences from prenatal through early child development to begin to understand what kinds of things influence brain development and function in children. And I've sat in on, by webcast, on their sessions, and there's been virtually no mention of any neurodevelopmental toxicants. I spoke with a toxicologist who studies the effect of endocrine disrupting chemicals on brain development and function in children and adults. And she's been trying for years to get the Society for Neuroscience to include at least one session in their scientific meetings on neurodevelopment toxicants and their effects on brain development and function. And she's had no success. So the emphasis in the early child development community is typically on nurturing care, nutrition, security, safety, responsible caregiving, and so on. All terribly important, but I wonder if sometimes we're dealing with what people consider to be a zero-sum game, where we can't include another variable for fear that it's going to dilute our attention to the thing we're most interested in. I don't know if that's true or not. And I also wonder whether or not what's going on is the goals are somewhat different. Are we trying to improve the mean across a population, or are we trying to close the gap to address the inequities? And I think we would address this very differently if we were trying to do that. So I think we ought to be very transparent about what the goals of our policy interventions might be, so we have some justification for what we're recommending without detracting from the importance of some of the other variables. So we're clearly dealing with a system challenge. We need, and this is a quote from Neil Halfon, who is a director of the Center for Healthier Children, Families, and Communities at UCLA, and he says, we need to think of it as a complex adaptive system problem and change the ecosystem of child development. But then if you look at the update of Neurons to Neighborhoods, which also comes from a National Academy of Sciences workshop, they say a discussion of systems is not very accessible to policymakers or the public. We need a better way to talk about systems so people can more easily understand what it means to support the child, the adolescent, and adult over the lifespan. And finally, just some opportunities to reflect on. I think we need to look at the research agenda, see how we might improve it through more systematic integration of the fields that I've discussed. Right now, there's a lot of siloing going on, and there's not a lot of crosstalk in some instances. I understand that's challenging for a lot of reasons, but I think we need to confront it. I also think we need advances in study design and data analysis. And finally, in practices and policies, we need more valid risk assessments. If we go back to the National Academy's report, Science and Decisions Advancing Risk Assessment, they made very clear that we should be looking at cumulative and aggregate exposures to non-chemical and chemical stressors when we're considering the impact of a particular stressor, a chemical stressor or other, when we're doing risk assessments. We need to learn from pilot projects and their successes and failures. Lauren mentioned the Cal EnviroScreen. That's really rich state-specific data from which we can draw to begin to think about how to address some of these research and policy issues. And around the country, there are a number of pilot projects which have had some successes and failures from which we can learn. I think they're happening at that level. They're not at the federal level. They're state and local levels. And finally, I think we need improved messaging and communication to get across some of the complexities that I've been describing that will help us figure out how to communicate this to the general public and to policymakers. Thank you very much.